Welcome to Discover Health, a White Mountain perspective. I am your host, Dr. Tom Barela. On this program, we are going to explore health issues that are prevalent in the White Mountains. We try to develop an understanding for these issues and utilize local resources to address the problems. Our guests will be drawn from local experts that are in the trenches and have our local perspective. Our guest today will be Miss Becky Moffett, who is sitting alongside me right now, a longtime dietitian, probably longer than she wants to admit, at Summit Healthcare, and recently became certified as a diabetic educator. You know, you like to talk about healthy lifestyles rather than diets and stuff like that. Just how do we get the recommendations for healthy lifestyles, and what are they?
Well, to be a healthy person, I think everybody knows what we should be doing, and that is probably moving more and eating less unhealthy foods. So if we move more and we eat healthier foods, hopefully we will lose some weight, and that helps us prevent diabetes.
So this is like what we've been talking about for years: exercise and food. So you're an expert at healthy lifestyles, and we're just going to let you go. Tell me how I can develop a healthy lifestyle and what the elements of doing it are.
Well, I think the most important thing is to enjoy your food. Food is not nutritious until it's eaten.
I do enjoy my food, but how do I tell what's nutritious and what's not?
Well, I hear a lot from people who say, well, if it tastes good, it must not be good for me. And I beg to differ. I say that it can taste delicious and be healthy at the same time. Look at this plate. It's colorful, it's appetizing, and it is half the plate is vegetables or fruits and vegetables. And that is the ideal. That's the easiest way to picture it in your mind. Every time you eat is about half, is it 2 to 1, you know, half of your plate, whether it's a meal or a snack. You want more fruits and vegetables, less starch and less protein, but you still want a balance.
I have to admit, I spent some time in the Orient earlier this year, and I ate from a Lazy Susan, Chinese food, and I have to admit, I lost weight eating all I wanted to eat. And I think one of the reasons was that I ate a lot more vegetables than I normally do. And that may be one of the things along the way that we need to do. So what other things are there so how do we get started in it? I mean, that's obviously the biggest issue, is how do we get started with developing healthy lifestyle habits?
You know, you can't get away from the eating part, and I'd like to focus on that as a dietitian nutritionist. Basically, back to this plate I held up again, it's a smaller plate. And so just by going from a 12-inch plate to a 9-inch plate, you cut at least 20% of your calories. And so it's all about calories, whether people tell you it is or not. It does boil down to calories as well as choosing healthy foods. So if you eat an extra 100 calories a day, you will gain 10 pounds in a year. But most people don't have the patience it takes to cut 100 calories a day and wait for a whole year to lose 10 pounds. This is what I've found to be true.
I mean, most people want more instant gratification.
Yes.
Is that a sign of our society, maybe?
Maybe so.
So, you know, I have, through the years, have used the example that, you know, a candy bar takes 30 seconds to eat, contains maybe 200 calories, maybe that reasonable? And how long does it take to wear off those 200 calories? I would say maybe an hour's worth of walking. I don't know this particular statistic, but it takes longer than 30 seconds to wear off that 200 calories that I just ate.
And it's very depressing to think about it that way. It's very discouraging. And so I do in my office, I have a body composition scale that measures percent fat and how many pounds of muscle you have. And I like to tell people that, number one, patience, like I mentioned before, is important. But the benefits of physical activity aren't just the calories burned. And you can tell by how your clothes are fitting if you're losing fat and gaining muscle. I've got my two models here. Here's a pound of muscle and a pound of fat. You can see the fat actually takes up more space. And so if you're losing fat, your clothes get looser. And that is the best way to tell rather than the scale.
So when you diet, do you get rid of fat?
Usually, you have to. You know, when people are young, they say, well, I'll just exercise and it'll make a difference. You can't avoid the diet. You've got to eat healthy. And most of us, it's just our environment. We live in a land of plenty, and there's way too much food available, and it's high calorie and tasty. We're hardwired to love the fat and salt and sugar.
Everything tastes better with fat.
Yes, it does.
Everything tastes better with salt. So, you know, when I grew up, just a couple years ago, I was always told to finish everything on my plate. I was always told, you know, that you needed to finish everything. So does maybe those habits start early in life?
Definitely, definitely. Our culture, the Clean Plate Club. You're a member of the Clean Plate Club.
I plead guilty. I plead guilty. If it's on my plate, I'm going to finish it. So maybe that 9-inch plate versus a 12-inch plate is a good way to at least get started when you at least psychologically feel like you're finishing the whole plate. And it's only 9 inches versus a 12-inch plate.
It works for me. I use an even smaller plate at home often, and I fill it up, but I can't fill it as much as I can a bigger plate, and it works for me because we do eat with our eyes as far as visually, you know, we do. So throughout the rest of this little conversation here this morning, I would like to think about also how to develop the healthy lifestyles. And this is an interesting concept in terms of how fast you eat is also a factor. Yes. It's a huge one. We eat on the run. We're busy. And I know for a lot of people, it really helps if you're wanting more food or you're wanting seconds. The best advice is to wait. Give yourself 15 or 20 minutes, and then if you're still hungry, then go back and have some. It does take 20 minutes for our brain to catch up and realize that we have enough to eat, that we're satisfied.
Does that have any effect on the order you eat your food? I mean, maybe if you ate, I mean, salads seem to come first, and at least from your description, salads seem to be a good way to fill up the stomach.
Some studies do show that it helps to have the vegetables or the soup first. They're heavier, they have more water weight, and it does help you feel more full with less calories.
The bigger the portion, the more you want to eat?
Oh, so many studies. You know, you're given one of those giant popcorns at the movie, people will eat the whole thing. We eat what we're given. It's pretty crazy. Most
people don't realize how many calories there are in popcorn obtained at the movie, and it really tastes so good.
I love popcorn.
So one of the other issues is sodium in the diet. Is that right?
Yes, it is. It's in any processed foods, we're going to have added sugars and added salt, and that's what we're finding is what is so unhealthy for our hearts, for our weight. Salt not so much for our weight, but sugars, yes. So I definitely ask people to cook from scratch as much as possible.
So when you look at sugars, they're different from carbohydrates because sugars are the carbohydrates. And I know in a lot of food labels there's sugar listed and there's carbohydrates listed. And it's the sugar that separate line on there that says sugars that's the baddie rather than carbohydrates in general?
Not necessarily.
Not necessarily.
No, because Unfortunately, our food labels do not differentiate between naturally occurring sugars and the added sugars. And so, use your common sense. You can look at the food ingredients and see, and you can tell. I do believe that naturally occurring sugars aren't near as harmful. It's always moderation. I've been doing this a long time, and it always boils down to moderation.
And how about the density of foods? I'm not sure how I think about density of foods.
Okay, nutrient density just means you get more nutrition in every bite than you would in a lightweight food. Let's say, like,
example?
Cheese puffs. Cheez-Its or something like that. Very little nutrition. Whereas you have an apple or you have a salad, you're getting
or a steak.
Spinach or a steak.
So rice cakes they're
mostly air.
Yeah.
There's not a lot of nutrition.
Watermelon?
They're very good for you.
Very good for me.
Yes.
Okay.
Yes.
All right. So let's, we talked about physical activity, we talked about variety of foods, and there's really a lot of choices. How do we train ourselves to do this? Isn't that the toughie?
It is. It is the toughie, and how I work with people and what I recommend is being accountable. Setting a goal that you can live with, and then being accountable to that goal, and showing me or showing someone else that you're making these changes that you need to. I'm sorry to talk in vague. Do you want something like a specific example?
No, because I know life is vague. There is no one plan for everybody. I want to, the concepts that you give here for developing a healthy lifestyle are really related to eating right, eating less sugars, eating less sodium, probably controlling the amount of fat relative to protein and carbohydrates that you eat. And it seems simple on the top. I want to go back and also, so two things are really come out of me. One is changing habits that are already there. But I want to ask you another question as a mom and also as a dietitian. How early do you have to start in creating good dietary habits? People have more emotional ties to food than they think they do. Even people who don't think they are emotional eaters. Our culture, we grow up with food. It's how we're shown love. A very early age is the answer to your question. I seem to have read a statistic years ago that if the risk for children being overweight is directly related to whether their parents are overweight. And the statistic essentially indicates that the parents' lifestyle and cooking choices then filter down to the child. So it's important to teach the parents not only to prevent being overweight later in life and the risk for diabetes. And I need to kind of finish up here, and we finish with a comment by Virgil, which is obviously one of your favorites. And
the greatest wealth is health.
Yeah, there's no substitute for health as you get older. I thank you very, very much for coming and sitting with me, and we'll be right back with our next guest in just a few moments. Thank you. Welcome back to Discover Health. In this segment, we will continue our discussion on healthy eating habits. And now we are pleased to welcome Jeanette Larson, a diabetic educator at the Summit Healthcare. And she has been a longtime educator and is well versed in the diabetic approaches to healthy eating habits and into life. And I welcome you to the second half of our program. And let's get right into it. Diabetes is an issue we read about in the newspapers and television all the time. What is the actual prevalence of diabetes?
It's actually a lot more common than most people think. We anticipate within the next several years that 1 in every 3 Americans will have diabetes, type 2 diabetes specifically.
That means that there are several thousand diabetics in our community?
At least. And we're also seeing a rise in prediabetes, which is a a diagnosis that the physician will sometimes give, and it gives you the heads up that your body's heading towards diabetes. And with the lifestyle changes that Becky and you were speaking about, and several others, you can either prevent or delay the onset of type 2 diabetes.
And now we have certain criteria that I know physicians are beginning to screen more often for the pre-diabetic state, especially in overweight people.
Overweight, there are several risk factors.
Okay, why don't you talk about the risk factors a little bit?
Yeah, there's some things that might give you the heads up that you're heading towards diabetes. One is that you are overweight, especially if you carry your weight around your middle. There tends to be some insulin resistance associated with the carrying your weight around your middle, your tummy.
So that's the pear shape?
That's the apple shape.
Apple shape. Ooh, I was trying to think that I could be thin on top. Okay.
That's the apple shape. Also, age. As we age, we are at more and more risk of type 2 diabetes.
Is that risk independent of weight? I mean, some people you hear older people developing diabetes, and really they're not always overweight as you get older.
Right, and it can be independent of weight. I don't want you to think that every person with type 2 diabetes is overweight. You know, I would say that weight is probably one of the biggest risk factors for type 2, but there are certainly people who are not overweight who do have type 2 diabetes.
Well, what are some other risk factors then?
Genetics are a big one. If you have family members that have had it, parents especially, siblings, you know you may be at risk. If you are a person with type 2 diabetes, it's helpful because that lets your children know that they're at risk for type 2 diabetes. And so genetics are a big one. Certain ethnicities are at increased risk for diabetes. The Latino population, the Native American population, the African American population. These are all populations that tend to have more diabetes than the Caucasian. But
just on a statistical basis.
Yes, but it is absolutely worldwide. Type 2 diabetes is increasing worldwide, not just in the United States.
Well, just what is diabetes?
Well,
type 2.
Type 2. So about 90% of people with diabetes have type 2 diabetes as opposed to type 1. So I'm going to keep my comments specific to type 2.
Okay.
And I teach people that there are 3 things that happen with type 2 diabetes. One, we have an organ in our body that's called a pancreas. And the pancreas's job is to produce insulin. And insulin, in turn, helps lower our blood sugars. As we age, sometimes probably due to genetics, our pancreas poops out and it doesn't produce as much insulin as it did in the past. And so that can cause our blood sugars to raise and may be a cause in type 2 diabetes. The second one we talked about was the insulin resistance. And if you carry your weight around your middle, you can assume that you have insulin resistance. I have a little visual aid here. This is representative of a cell in the body. And what the job of the insulin is to unlock the cell so that the glucose or the sugar can go into that cell and travel to places in the body like the muscles and the brain and give the body energy. This is what the body uses for food. So if we don't have enough insulin in the body, our pancreas is pooped out, the cell can't open to take the glucose in. But if we're carrying our weight around our middle, it changes the way this cell works so that even though the insulin's there, the cell doesn't pay attention to it and it doesn't open. And the glucose continues to build up, or the sugar continues to build up in your bloodstream. Sometimes so does the insulin.
So for most people that have diabetes, does it not usually start, with insulin resistance? And then maybe just thinking maybe as age goes on, the pancreas gets tired of producing all that insulin and
Yes.
it wears out?
That's exactly correct. That's exactly correct. And I think that's why one of the things you can do to help prevent or delay the onset of type 2 diabetes is to lose weight. And it just needs to be 5 to 10% of your body weight. But by losing the weight, it helps your cells become more sensitive to that insulin and open up so that it can take that glucose to where your body needs it in the body.
And I know later on you're going to talk a little bit about how we treat it and on the modalities that we use to treat it. Well, you know, we've talked about being overweight as a sign of diabetes, but there must be other things like, what are the symptoms? I mean, how can I tell that I'm a diabetic? Or maybe I can't.
Well, you know, a lot of people, when they're first diagnosed, especially if they're diagnosed because they're having trouble, will have, they're needing to go to the bathroom a lot, urinary frequency. So they're having to go to the bathroom a lot. They're very, very thirsty. It's an unusual thirst. And with a lot of adults, blurry vision can be a sign of high blood sugars. And they feel really tired or lethargic. Those are the biggest complaints I hear from adults with type 2.
So the going to the bathroom a lot is because there's too much sugar in the blood, because it can't get through into the cells because either the insulin isn't there or it's not working as well. Right. And the drinking a lot is because you're essentially going to the bathroom a lot?
Yes, I don't know which comes first, the chicken or the egg, but yeah, absolutely.
And then you get up in the middle of the night a lot because you're having to go to the bathroom a lot.
And I have patients tell me that they're getting up 4 or 5 times a night. So it's really a remarkable frequency.
So talk about prevention. I mean, is there anything other than the obvious, which you've alluded to several times in terms of weight control?
Weight control, and I don't want people to think that when we talk about weight control that we're talking, telling them they have to lose 120 pounds. We're asking them to initially just work on losing 5 to 10% of their body weight. So that's 10 to 20 pounds for most people.
Most people.
Physical activity is probably the best treatment and prevention for type 2 diabetes. When we talk about the insulin resistance, we can't make a medication that works as well as physical activity. And when I talk about physical activity, I don't want people to think that it's, I have to go out and run or I have to have a membership to a gym. That's not true. Whatever activity you enjoy, do it. Try new activities. I would encourage people to work up to 30 minutes of physical activity at least 5 days a week. With that being said, though, if someone's not physically active, I don't want them to think that they're a failure if they're not getting to that.
And Becky talked a little bit about how you can essentially institute healthy treatment habits and along those lines. So, we've talked about preventing, and I know one of the things that a lot of people worry about are the potential complications of diabetes.
And most people don't realize that the number one complication of diabetes is heart disease. So things like keeping your blood pressure under control, watching your cholesterol, these are things that will help prevent heart disease. And when I say heart disease, I mean heart attack, maybe even stroke. But those are the number one complications of diabetes.
Yeah, but that isn't what people are thinking about all the time. I mean, that you hear people talk about blindness as a part of diabetes.
Blindness and kidney failure and losing toes and feet. Those are all very big concerns for people with diabetes. We have the ABCs that we use to teach our patients. There's 3 things that we encourage people with type 2 diabetes to look at. One is their hemoglobin A1C, and I will explain that in just a minute. Second is their blood pressure, and 3, the C is the cholesterol. So let me talk to you about the hemoglobin A1C. This is a pillow that is representative of a red blood cell in our body. And
That's the hemoglobin A.
It's the hemoglobin A, yes. And as this passes through the blood vessels in our body, it picks up little pieces of sugar or glucose as it passes through our bloodstream. And this sugar gets stuck to this and it doesn't let go. And so when the physician asks us for a blood test. One of the tests he can order is a hemoglobin A1C, and the lab can take that and look and see how much sugar is stuck to this red blood cell, and then we can get an idea of what the blood sugar's been running.
So normal value, that's probably 5.5 to 6.
Yes.
And the more sugar there is in the blood, the higher that number gets.
Exactly. They can see that there's been a lot of sugar circulating through the bloodstream.
Wow. Well, that certainly is one of the objective measurements, and you can repeat that every 2 or 3 months, I understand, in terms of monitoring your progress.
Yes.
So while you're working on your weight and you're working on your exercise, you can actually have another objective measurement of whether you're being successful, and cholesterol is another monitor that you can use with a diet and healthy habits, and also eating right so that we don't become overweight.
Yes, and eating foods that are healthy. Lots of fruits and vegetables. I don't want to forget stopping smoking. Smoking increases our chances of heart disease. It increases our chances of problems with our feet and our toes in type 2 diabetes. So that's a big...
And we all know that smoking goes along with heart disease and lung disease and stuff.
Yes.
Wow, a very, very complicated issue. Now, I understand that diabetes, you guys have a diabetic education program at the hospital for outpatients. If their doctor wants to refer them to your program, that you will be happy to teach them all of these wonderful things in a lot more depth than we're able to go through today. We thank you for watching and hope you will continue to come back. Thank you.